Indonesia's President Joko Widodo has declared a public health emergency in the battle against COVID-19. There will be large-scale social restrictions and additional measures to help people with lower incomes. Indonesia has also banned foreign nationals from entering and transiting through the country. The death toll in the country stands at 136, with more than 1,500 infected. For the latest, our correspondent Chandi Madvani joins us live from Jakarta. Chandi, what is the significance of the public health emergency declaration?
Well, with the public health emergency declaration, authorities have allocated additional funds amounting to nearly $25 billion to help ease the impact of COVID-19 on the Indonesian economy. Now, this figure is anticipated to widen Indonesia's budget deficit to over 5% of GDP, which is its biggest in a decade. Now, according to a statement on the Cabinet Secretariat's website, President Widodo has signed a government regulation in lieu of law on the state financial policy and financial system stability. Now, this regulation allows authorities to take extraordinary measures to ensure public health, save the national economy and the financial system. And this regulation would waive a cap on maximum budget deficit for 3 years.
Chani, what are some of the measures that we know are going to be imposed here?
Well, large-scale social restrictions, according to Mr. Widodo, will be based on the 2018 law on health quarantine. Now, this allows cities and provinces to shut down non-essential services and limit religious and social activities. Now, we know that some provinces like Tegal, we know a city like Tegal, which is in Central Java province, and Yogyakarta have already implemented various forms of restricted access within and around certain areas. Some have even already implemented partial quarantines. Now, with the large-scale social restrictions, it is a possibility that more provinces could follow suit in the coming days or weeks. Now, under the large-scale social restrictions, schools, workplaces, and places of worship will be closed, and this means that there are over 50% of Indonesia's 130 million workforce who work in the informal sector who could potentially lose their jobs and income in the coming months. Now, the additional fund allocation will be distributed to various elements of the community and sector. And these include healthcare, social protection for millions of families, workers who will be affected by layoffs, micro and small businesses, a compensation for the death of medical personnel, among others. Earlier today, we also heard Indonesia's foreign minister announce that all foreign arrivals and transit in Indonesia will be banned. Only foreigners with residence visas and some diplomatic visits will be exempted from this measure.
And Chandi, Indonesia is set to release some 30,000 prisoners early. That's to avoid a possible surge in infections in its overcrowded prisons. Is there public concern over this move?
That's right. A document which was reviewed by Reuters, it was issued by the Law and Human Rights Ministry. It stipulated that adult prisoners would be eligible for parole if they had served 2/3 of their sentences. Children, on the other hand, would be eligible if they served half of their jail term. Now, as you mentioned, the ministry spokesman did say that the parole would encompass around 30,000 prisoners. We know that in Indonesia, overcrowding in prison cells is a major problem. Authorities have also prioritized, and they have repeatedly stressed that amid this COVID-19 pandemic, public health safety is their #1 priority. Many centers lack proper sanitation, which in turn makes inmates vulnerable to the spread of disease. So up until this point, I believe there's been more concern about the virus spreading and what authorities can do to stem that spread.
Okay, many thanks for that. Chandi Madvani speaking to us from Jakarta.